ASTHO/profile. So again, I want to welcome you to the 2016 ASTHO Profile Survey Q&A webinar, and let's get started. So first, to give you a couple of key dates for the ASTHO Profile Survey. As many of you know, the survey was launched on Monday, April 18th, and the survey is due on May 31st. The survey administration, we're going to be administering the survey online through the Qualtrics survey software platform. Primary contacts for each state and jurisdiction received an email from ASTHO last Monday with a unique link to the survey and a PIN for submission. U.S. territories and freely associated states received a modified version of the survey. There are 8 sections to the survey, and these sections are listed on the next slide in the table of contents. So there's a section on contact information, activities, agency structure, governance and priorities, workforce, finance, planning and quality improvement, health information management, and then we ask just a few questions asking you to evaluate the profile so that we can help make improvements for the next year. So to go over a few key logistics for the survey. First, the survey can be completed in multiple sittings or by multiple personnel. However, the survey can't be completed by 2 people at the same time. So you're going to want to coordinate who is filling out the survey. The survey works best using Firefox or Google Chrome as the web browser. You can use Internet Explorer, but we have found that there can be certain little quirks, and so if possible, you'll want to use Firefox or Google Chrome. We have 2 recommended ways of completing the survey. The first is that the unique survey link that the primary contact or senior deputy received can be forwarded to state health agency personnel who can then complete individual sections of the survey online. Alternatively, the senior deputy or primary contact can print out blank copies of the survey, distribute these copies to personnel who can then complete them as hard copies, and then have one person enter all of your responses online. We ask that you respond to all questions to the best of your ability. Even if the response that you want to write for an answer is 0, we ask that you please write in the 0 instead of leaving it blank. This will help us differentiate between missing data and data for which your response is actually 0. For part 2, the activity section, we ask that you fill out both of the columns performed by the state public health agency directly and contracted out by the state health agency. So it's possible that you could have something that's performed directly by the state health agency and contracted out, or something that's performed by the state health agency but not contracted out, et cetera. So we would like to know for each of those options if it's a yes or a no. The workforce and the finance sections have additional definitions and clarifications for certain questions. So you can view the definitions for certain categories by hovering over the text that's in the blue font, or by clicking on the hyperlink for a Word document that contains these definitions. So whichever option is easier for you. Some like to hover, and others would like to have a copy right next to them. Also, depending on your answers to previous questions, some questions may be skipped or certain question numbers may appear to be missing. But don't worry, this is due to skip logic and is intentional. Depending on your previous responses, there may be some questions that are not applicable, and so we do not ask those of you. To save data, data for each page will automatically be saved by clicking the Next button at the bottom right-hand side of each page of the survey. Responses can be changed at any time prior to submitting the survey. Please do not press the Back button on your browser, as responses will not be saved. So a couple of reminders about navigating the survey. The questions are divided into several sections and question subsections for easier navigation. If you click on the table of contents, that's the icon with 3 horizontal lines on the upper left-hand corner of the screen. You can move to different sections and questions throughout the survey. One thing to note is that check marks will appear next to each section once you have read that section, even if you have not completed the section. So please do not go by the check marks as an indication of whether or not a section is complete. You'll want to go through and make sure that you've answered the questions. At the end of the survey, you'll see an individual profile for your state or territory. Based on your responses, These profiles will be presented and contain key information including your agency mission and top 5 priorities, your structure and relationship with local health departments, organizational structure, health planning and accreditation, and workforce. Each agency's profile will be presented for review prior to submission, and you'll have the opportunity to edit any responses that aren't accurate before submitting the survey. We've also put the question number in parentheses next to each item so that you can know where to go back and change your response if a response that you have written is not accurate. To submit the survey, we've sent you an email with the survey link. We also sent you a unique PIN to enter at the end of the survey prior to submission. We ask that you review your responses prior to submitting the survey. You can also print out a copy of your responses upon submission. So now that I've gone over a couple of the logistics, I wanted to go through some frequently asked questions or questions that we've already received at this point and give those responses, and then have an opportunity for you to ask additional questions that you might have. So first question, do I need any login information in order to fill out the survey? No, you don't need any login information. The individual PIN that we have sent you is used to ensure that the senior deputy, your primary contact, has approved of all the answers prior to submission, but there is no login information required to access the survey. Can I get a Word version of the survey? Yes. I have sent out to all senior deputies and primary contacts a Word version of the survey. In addition, if you don't have that email handy, a Word version of the survey can be accessed in Qualtrics by clicking on the instructions section and clicking on the subheading under print and going to the subheading Printing a Blank Survey. If you forget to print out a copy of your responses after submitting them, ASTHO can provide you with a copy of your responses. We can also provide you with a copy of your responses to the 2012 profile survey. I know that for some states and territories that's helpful for them as they start to plan filling out the survey. You can also designate someone else as the primary contact for the agency. If it's not the senior deputy, please let us know who we should be sending correspondence to related to the profile. For any of these items, you can contact us at surveyresearch@astho.org, and we will get back to you with the information that you need. Another question that we've gotten is asking for what portion of the agency or department should we respond. So you should be filling out the survey from the perspective of the state or territorial public health agency. That is the unit of your state or territorial government that includes the full scope of traditional public health services. We'd like information on what's under the purview of the ASTHO member, so that's the state or territorial health official. Please do not include other departments that may be within an umbrella agency, such as Medicaid or Senior Services, if they are not within public health. How should centralized states respond to the activity section? We ask centralized states to respond yes only for activities that are performed directly by the state health agency. Please respond no for any activities that are conducted by the state health agency via its local entities. Another question that we've received is asking, should all questions be answered using fiscal year 14 and fiscal year 15 figures, or just the finance section questions? So the finance section asks specifically about fiscal year 14 and 15, so we ask that you respond for those time points. There are some other questions on the survey that will specify a time point, for example, asking about something that occurred in the last year or in the last 5 years. In those instances, we ask you to use that time point. If no time point is specified, though, please let us know what's currently happening at your state health agency. So, for example, for the activities section, we are asking about what's currently going on at your state health agency for the majority of questions. Another question that we've received is asking why you may not be able to move on from certain sections of the survey. So for a very small number of questions, we've included validation to help with data cleaning and making sure that responses make sense. In those instances, it makes it more difficult for you to move on. They ask for you to complete that question before moving on to another section of the survey. You can bypass this, however, by just clicking on the table of contents to another section of the survey, and you will go to that section, and then you can come back to the other question later. When will the results of the survey be published? We anticipate publishing the results of the survey in the spring of 2017, but we will keep you updated and let you know once we are getting close to that. I also wanted to let you know of something new that we are doing for this round of the survey, which is having an FAQ newsletter. So starting next Tuesday, we're going to be sending out a weekly newsletter to primary contacts with frequently asked questions from the prior weeks. Please continue to email us your questions, as these may be helpful to others who are filling out the survey, and this will give us an opportunity to respond to those questions. So I want to pause for a moment and see if we have questions at this point from you that we have not already covered.
The conference has been unmuted.
And so we'd be happy to answer those at this time. So please just are and where you're calling from, and let us know your question. You can also type in questions into the chat box, and we can read those off of the computer.
Do you want me to read it?
Yes.
So we've been asked in this context, does fiscal year mean the federal fiscal year of October 1 to September 30th?
That's our fiscal year.
Sorry, did someone say something? We can't quite hear you.
So the fiscal year we have specified in the survey is July 1 to June 30th.
Oh.
Does that answer your question? And it's written in the instructions for the finance section. What other questions do folks have? Please just either chime in or feel free to use the chat box if you'd prefer. So we have a question asking if the previous surveys are available to review. Yes. You can email us at surveyresearch@astho.org, and we can provide you with your agency's previous survey.
All right, so another question received is about performing versus contracting out. Questioner says, we reimburse local health departments without contracts. Is that the same as contracting in this instance? Also, the first questions have no year. We assume you mean 2015, or do you mean 2016?
So I don't know, Katie, if you want to respond to the first part of that.
The first part was about local health departments. So
Without contracts.
So you have local health departments doing the work without a contract. I guess
we pay. Can you hear me?
Yes.
This is Sylvia Perani. We pay local health departments to do some of that
yes.
work.
We would.
Florida.
You're right. That is not technically a contract, but we would think of that in the same way as a contracting arrangement. So thank you for the question. That's a good clarification. We would like you to enter that as if you contract with the local health department.
And then is this work performed, are you asking for 2015 or for 2016?
So for the activity section, we're asking about what's currently going on at your state health agency. So I would say to answer for what's going on now in 2016. For the finance section, we do ask about fiscal year, so that would be a different time point. But if you don't see otherwise, I would respond for what's going on right now.
Thank you.
That doesn't make any sense, no.
I guess I assumed we were answering all the questions with one time period in mind.
Hi. We do ask for historical data on the finance section, but it's really quite clear.
Yes.
Yeah. Was someone else asking a question?
Yeah. Hi, this is Andy. I'm from South Carolina, DHEC. We're a centralized health agency, so we don't have any local independent health department.
Right.
And so based off of that previous question, I'm trying to figure out, so we pay for all the services that are handled by our local offices, should we count them as being contracted out?
Actually, that might be a good way to handle it. I know that we've been in touch with South Carolina previously because we were trying to clarify when we're looking at we were trying to clarify that what we're trying to learn about is what the central office does. But if what you're talking about is central office working with the local health departments to do it, I do think that very strongly resembles a contractual relationship. And so, yes, I do think that you could enter that data as contracting out.
So this is Tracy Dolan in Vermont. We have never done that historically in the past, answered those questions that kind of way. So I think it would just be really great to get maybe a written policy on that, because that would really change the nature. So because we're also centralized, our presumption is that all of our arms in the districts are the Vermont Department of Health, and so then we do not refer to that as contracted out.
Okay, yes. So we got some of that feedback in response to the last survey, and we tried to clarify it. And it seems now from this call that the clarification wasn't quite clear enough. So we will need to send out another message about this with further clarification, because as you can see, it's not totally straightforward.
Are there other questions that folks have?
This is Sylvia Perani, New York again. We're a large state. I'm referring to question I guess I can't read this number so small, 3.2 about the super agency versus the umbrella agency. Mm-hmm. Super agency or umbrella agency or independent agency. We're a large state health department with Medicaid, but we report directly to the governor, so that makes us an independent agency. We have some of the services that you've noted, that would belong to a larger agency like Medicaid and long-term care. Those belong to our state health department, but we report directly to the governor. So does that make us an independent agency?
Give me just a minute to answer that question.
Yep.
They still do. Yeah.
So because the guidance is that you're answering just on behalf of the Public Health Division, that means that you would characterize yourself as being under a larger agency, because that Public Health Division is under a larger agency that has the Medicaid, et cetera.
Well, the larger agency is the New York State Department of Health.
Right.
Got to do with the survey. Yes, your questions.
Well, can you guys think about that? It doesn't quite make sense. There's other set of activities then that we wouldn't give you budgets for, even though they're part of our health department, because I don't know. Okay.
Well, I mean, we have the Medicaid, for example, taken out of the financial data.
Right, but you also asked for surveillance at one point, like hospital surveillance. I thought that was a question. I did a quick scan. I thought you were asking for some of that at some point.
Hospital surveillance.
I don't know. I'll have to go back and find that to see where that was. You're asking for clinical services. Quality of health services. There you have it. You're asking for quality of health services. For me, that means surveys of hospitals and long-term care facilities, which our state health department does, but not our Office of Public Health within the state health department. Same thing, vital statistics is not in our Office of Public Health.
Okay, just 1 minute, Sylvia. I want to read to you the part of the instructions that I think will help clarify this.
Okay, thank you.
Yep.
I'm looking at the PDF, so I might not be seeing things lit up with definitions.
Get that done, because I want to really work on this.
Also, it would help us figure out how we answer the questions about the services we offer versus any smaller Office of Public Health versus other parts of our state health department. So I guess it is important, but yeah.
Hold on one moment. We're just trying to make sure we give you the most accurate information.
Yeah. Tone. Actually, Brian's agency is, his consulting agency could handle it. No, I believe.
Hi, Sylvia. So we can't find exactly what we're looking for right now, unfortunately. So we're going to send out a follow-up email with that information.
Perfect.
Yes,
That
so
would
we'll
be,
send it
that
to
would be helpful.
everybody.
Yeah.
And it will have this clarification on the centralized, decentralized issue, as well as the public health division versus the whole health agency issue.
Thank you.
I apologize that I can't put my fingers on it right now.
We just received a question. It's if we do some part of a service but not all, should we still indicate yes?
So I assume that you're talking about the activities section. So yes, if you do some part of the service, you should indicate yes.
And just one more question on centralized. On
Sure.
question 2.22, it says we're interested in knowing about your state public health agency's collaboration with a number of types of government and non-governmental organizations. So for us, we don't have local public health agencies because we are public health and it's central. So we would just not check off any of the things under local public health agencies because those are our offices. Is that correct?
Yeah, I think that's fine. I think that's the kind of question that needs to be interpreted with that knowledge that you're answering on behalf of your whole health department.
Yeah, and I don't know if I might have missed the directions, but I think just a quick direction on the difference between how we should answer some of these if we're centralized versus if we are an agency with independent local agencies. I think that kind of guidance would be good. It was helpful in the accreditation, when they had real clarity around the difference. This might be helpful there too, just a couple of bullets around how we would interpret it differently if you're centralized versus not centralized.
Yeah, you're right. We should look at that FAB guidance since they've already ironed some of that out. That's a really good idea.
you have any other questions. Obviously, you can always email us or give a call if you think of questions at a later point, but we're happy to take any other questions that you have now, and hopefully we can answer them at the moment, or if not, we can send an email a little bit later with a response.
Can I ask one more question? Sorry, this is Tracy. I'll stop soon.
No problem.
It says what are the top 5 priorities for your state public health agency for the current fiscal year. And I think it would be, I'm all about consistency, and so if this information is useful, I think it would be great if we were guided in the same way. I think we're all required to have a state health improvement plan as per kind of moving toward accreditation. I wonder if we do have a state health improvement plan, if it would be helpful guidance to state that that's what you're looking for there. Depending on who's filling it out, depending on how close they are to the state health improvement plan, you could kind of get priorities right now versus priorities from the state health improvement plan, and it's just something to think about.
Yeah, that's one of those questions where we've tried to keep it consistent over the years, but that state health improvement plan has obviously changed and become much more common over the years. I'm not sure that every state is doing one, but
that's true. Yeah.
You're right. That is a good way to think about it. That it might be common enough now that that's the most consistent way to get that data is to give that guidance.
But I can see if you asked it the same way for years too. So my comment might not be relevant there.
Anything else in the chat box? Okay, well, I think just to go to the last slide, again, this is our contact information. So for general questions, you can email us at surveyresearch@astho.org, or you can give a call, 571-318-5404. We also have the individual emails of our team members listed here if you'd like to contact us directly. And we want to thank you for participating in the webinar. We also are excited to announce that we've already had one survey complete. So we have gotten response from the various states of Micronesia, so we want to thank them for completing the survey so quickly, and we're looking forward to receiving your responses. So thanks so much, and have a good day.